Alright guys, so this is basically how doctors figure out if your body is getting enough oxygen and if your blood is too acidic or too basic. What's up? I'm Dr. K in Progress, and I'm going to try to go through every medical test that I can. I'm going to try to do once a day so you guys can understand what these tests are and you won't be so foreign to them. So this test is called an ABG, and ABG is called an arterial blood gas, and it checks your oxygen, your pH. It's typically used in the ICU, ER, and in critical care. So the easiest way to understand this is first to check the pH. So think of pH like a balance, right? Too low is too acidic, too high is too basic, right? And then what you're going to do is you're going to check the CO2 level. CO2 is controlled by your lungs. That's why there's this image in your lungs. So if somebody isn't breathing well, CO2 is going to build up because you need to breathe in oxygen, and that makes the blood more acidic. And if someone is breathing super fast, they blow out too much CO2, and then the blood becomes more basic. And there's something called bicarbonates. That's HCO3 negative. That's controlled by the kidneys, and that's why that kidney is there. And it basically acts like the body's natural acid blocker. So more bicarbonate is more basic, less bicarbonate is more acidic. That's why I said HCO3 is same. So high is high, low is low. So more basic, more acidic. Then down here I wrote the four most basic disorders actually doctors usually see. So the first one is respiratory acidosis. The second is respiratory alkalosis, then metabolic acidosis, then metabolic alkalosis. And over here is oxygenation, which is basically how well oxygen is moving throughout the blood. And if you guys want me to explain this to you guys in further detail, I can. But I'm basically trying to work out here like what these certain things are, especially with ABGs, and I'm trying to help you guys out. So respiratory acidosis is when your pH is low and your CO2 is high. So this is typically caused by chronic obstructive pulmonary disorder, opioids, and hypoventilation. It's not breathing enough. That's why you have a lung here that's kind of like, I need more air. Respiratory alkalosis is when your pH is too high and your CO2 is too low. So that is when typically anxiety, panic attacks, hyperventilation. So hyperventilation is you're breathing too fast, hyper. And PE is called a pulmonary embolism. Metabolic acidosis is when your pH is too low and then your bicarb is too low. DKA, so that's diabetic ketoacidosis, sepsis, diarrhea, and then renal failure. That's why there's kind of a battery there, and then there's some battery acid. And metabolic alkalosis is when your pH is too high and your bicarb is too high. That's typically when you're vomiting or your antacids, and then your diuretics like Lasix or furosemide. And that is all. Text me or just DM me or whatever if you guys want this cheat sheet, and thank you guys very much.